Polycystic ovarian syndrome is a disorder of the ovaries, a condition in which the body produces excess of a hormone called androgen. For a normal female, the body is supposed to produce more of estrogen and progesterone. These are the two hormones that help to regulate the normal menstrual cycle. Either after 28 days, if there's no fertilization, the woman gets pregnant, or if there's fertilization, progesterone takes it on and then it becomes full-blown pregnancy. But in the case where someone has PCOS, there is more of androgen, which is a male hormone. What are the causes of this? Number one, I already talked about the number one cause as being hormonal imbalance. Number two could be hereditary or family history. So if someone has had a mother who has been diagnosed with it, the chances of the daughter having it is also high. So if you have a family history of that, then you need to watch out and follow through on this video. Number three, cause could be contraceptives. When people take drugs at the time when they are not ready to be pregnant, they take drugs so that they can be pregnant. You find out that because of those drugs that they have taken, the side effect of those drugs cause them to have this condition known as PCOS. Another thing that can cause it is insulin resistance. Now, insulin resistance is a condition in which the body produces insulin, but the body is not able to utilize that insulin. Now, those excess of insulin that are stored in the body or that are not used by the body can trigger the ovaries to begin to produce excess of androgen, which is also the condition that leads to PCOS or polycystic ovarian syndrome. Another cause of this could be statin drugs. Statin drugs are drugs that are given when someone has high level of progesterone. Studies have shown now that the long-term use of statin drugs can lead to this condition known as polycystic ovarian syndrome. Also, sex hormones. Women use sex hormones to do some things, to make some body features to be in a way that that they want. So some of these sex hormones can alter the normal balance of the body and cause excess of production of androgen. A female should have very little level of androgen in their body, but for any reason for which you are taking these sex hormones, it may make you to have more androgen and less progesterone, estrogen, and then you find out that the person may develop polycystic ovarian syndrome. Sometimes, most of the times, people that have PCOS would usually have cysts in their ovaries, but there are some cases where a woman can go and do a scan and there is no cyst, but she still has the symptoms of polycystic ovarian syndrome. And who can have it? Usually, it's been shown now that anybody from the ages of 20 years and above can be diagnosed with polycystic ovarian syndrome. So it's not a disease for the young or the old. It's a disease that can affect anyone whose hormonal levels are imbalanced. Now, there is no evidence to show that infection can cause polycystic ovarian syndrome. So if anyone told you that, that would be a lie. It's usually as a result of hormonal imbalance. Now, what are the signs of PCOS or polycystic ovarian syndrome? Number one sign is abnormal menses. Now, abnormal menses could be irregular menses, could be absence of menses, could be absence of ovulation, could be erratic ovulation. So all these things are something that a woman may notice. So if you experience any of all these things, then it's time to go check yourself. Another thing another symptom could be acne, big acne, cystic acne. This acne that form big balls on your face, then. Or another point again could be thinning of hair. You just find that the hair around the edges are beginning to thin off, or the person is getting bald. Then another part of it is a condition known as tissuism, in which there is a lot of hair. There's hair on the face, hair in the jaw, hair in the chest, hair in the arm, hair in the leg, hair in the groin, hair everywhere. I mean, the woman is developing growing hairs in areas that a man naturally would have grown hairs. So these are things that when you observe them, then you want to find that you need to go do some check. Another point again is obesity. Yes, you find out that you're trying to lose weight and you are not able to lose weight. You are doing everything right, but yet your body is not losing weight or shedding weight. That could be because of PCOS. Because remember, in the case of PCOS, there is insulin metabolism is not balanced. Also, another symptom of polycystic ovarian syndrome is darkening of patches of the skin. I needed to talk about this. You just find out all of a sudden there are patches around your face, around your neck, under your breast, and your thigh, some dark patches. Now, this condition is something that you should not throw away. These are classical signs. And then also there can be skin tags. Tags are these things, that flaps of skin that just come up around the body. And then the last but not the least point could be infertility. Because the woman is not ovulating, then there's nothing there's no fertilization, and because there's no fertilization, pregnancy cannot occur. Now, these symptoms are symptoms. There may be other symptoms, but these symptoms are the classical symptoms of ovarian syndrome. I'm going to run through them again just for you to get them. I talked about irregular menses, I talked about abnormal hair growth, I talked about acne, I talked about obesity, I talked about darkening of the skin, I talked about cysts, which could be in some cases someone may not have cysts. I talked about skin tags, I talked about thinning of the hair, I talked about infertility. Now, these points are very, very valid, and they are not things that you should ignore. Now, if you experience these symptoms, what should you do? Well, you shouldn't go looking for what to drink. You need to do a consultation. You need to be assessed. You need to be assessed to find out what the state of this, whether you have a cyst, what the size of the cyst is. Because honestly speaking, if a cyst should rupture, that is a medical emergency. So this ovarian cyst is not something you just go doing home remedies for. No, I would not advise you to do a home remedy for yourself. Also, if you are trying to conceive, then there are other factors that has to be put into consideration in your treatment. But generally, there are some things that, allow for the PCOS to thrive better or to do better. There are certain foods or certain things that when you eat them, if someone has PCOS, eating those things aggravates the condition or makes it worse. So one of those things are dairy products. You need to stay away from dairy products. You need to stay away from corn flour. You need to stay away from corn flour. You need to stay away from white bread. You need to stay away from sugar. You need to stay away from barley or malt. You need to stay away from flour. These things are not bad in themselves, but if you have been diagnosed with PCOS, then it's good you stay away from these things. Now, what other things can you do or can you take? I would advise you to take flaxseed. Flaxseeds are very good. They are natural. You can eat them raw. You should take oats. Oats are very good. Now, these are not cures, but these are things that can help you when you are experiencing some of these symptoms. You need to stay away from caffeine, alcoholic drink. You stay away from there. And then I have a 2-week liver therapy, but I'm not going to give it to you. It's free of charge, but I'm not just going to give it to you. So if you want to be a part of that, those people that are going to, if you want to have access to that 2-week liver therapy, then you need to drop a message in the comment section and it will be sent to you. The link will be sent to you, and then you can download the version, the downloadable version, and then you can take it. That 2-week therapy, what does it do? It helps to improve metabolism. Remember that one of the things that aggravates or causes PCOS is metabolic disorder. So once your liver is functioning well, now this is not a liver detox. This is a liver enhancement stroke metabolic functioning therapy, improving therapy. So for people who have PCOS, it's very good that you take this therapy. Now, even if you do not have PCOS, do not wait till you have PCOS. You should indicate an interest for you to get access to this therapy. It's something that you can do by yourself in your house, but it has to be done we have to supervise you. That's why we're not dropping it just for anybody. If you've been diagnosed with PCOS, please reach out to me, send a message, send a comment, book a consultation. You're trying to conceive, book a consultation. I've done other videos. Look out for the other videos that has to do with hormonal imbalance. Look out for the video that has to do with fertility. Whatever it is that you're going through, reach out to me. I'm there. That's why I'm here. I'm here to teach you to be well. I'm here to help you to be well and to teach you to stay well at an affordable cost. Well, affordable cost because if you need to get some things, you will need to get them. But for the things you do not need to pay for, then you can get them free of charge. But don't forget this 2 weeks liver enhancement stroke metabolic therapy that I'm talking to you, that I'm going to give you free of charge. You just have to click the link to drop a comment in the comment section that you want it, and it will be sent to you to your email. So I believe that I've been able to answer some of the questions you have on PCOS, and if there's any other question or topic you want me to talk about.